What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to talk about the celiac trunk, and let's go back to the abdominal aorta. We said the abdominal, you have to watch the previous discussion. The abdominal aorta has got 4 unpaired branches. Of these 4, 3 of them are coming anterior, and one of these 3 is called the celiac trunk, and the celiac trunk is the topic of discussion today. The celiac trunk is the primary artery which is supplying the foregut. It supplies all the way from the distal third of the esophagus to the midpoint of the second part of the duodenum, all the way from the distal third of the esophagus to the second part of the duodenum being supplied by the branches of the celiac trunk. Is a primary artery of the foregut. We mentioned about this the other time. Yeah, so this is your celiac trunk. Is usually a short artery which is running from abdominal aorta, but at what level? See, it's almost at the level of T12, lower border of T12, or sometimes the junction between T12 and L1, this disc. And most literatures are writing T12, but sometimes they are right in the lower border, the upper border of L1. That depends, and I think at least you can see the relationship. Okay, yeah. So we have mentioned that this artery supplies everything from the lower third esophagus to the second part of the duodenum. Okay, this is esophagus. It supplies the esophagus, supplies the stomach. It supplies the pylorus, supplies the duodenum, and until the second part of the duodenum be supplied by this artery. But it also supplies liver and everything which is in the supracholic region. Remember, you divide the abdominal viscera into supracholic and infracholic viscera. The supracholic are being supplied by the celiac trunk because they are found in the foregut. The spleen is also supplied. Yeah. Okay, so what are the branches of the celiac trunk? Well, the celiac trunk has got three branches, and these are the left gastric artery. This is the left gastric artery. The second one is the splenic artery. I'm going to tell you later today that splenic artery is the tortuous, and the third one is the common hepatic artery. And sometimes these branches of celiac trunk, they come as trifurcation, like the celiac trunk is one, and then it trifurcates. It gives three terminal branches at the same point. That is called the true trifurcation, and in that situation, the celiac trunk is also known as a hepatogastro-splenic trunk. Hepatogastro-splenic trunk, because give the hepatic branch, it gives the gastric branch and the splenic branch at the same time. Trifurcation. But this one is a forced trifurcation because it gives first artery before it bifurcates into two terminal branches. Okay, so this is a forced trifurcation. But a true trifurcation would be the celiac trunk gives three terminal branches at the same level. Before, you see here, the left gastric artery left before the celiac trunk would divide into two terminal branches. See, this is forced trifurcation, and this is true trifurcation, and this situation is called the hepatogastro-splenic trunk. It is a trunk. So the job today is to discuss these branches of the celiac trunk. So the first branch is called the left gastric artery, and the left gastric is usually the smallest of the branches of the celiac trunk. Okay, this artery is going to supply the lesser curvature of the stomach. It supplies the lesser curvature of the stomach, but it also gives the branch which are going to the esophagus. So it gives esophageal branches, and then it lands on the lesser curvature of the esophagus of the stomach to supply. But it also anastomoses, because the left gastric artery, we're going to see that it anastomoses with the right gastric artery, but the right gastric artery, it is not coming from the celiac trunk. Okay, it's coming from a branch of the celiac trunk. That is the left gastric artery. Next, let's see the splenic artery. The splenic artery is the biggest of the branches of the celiac trunk, biggest of the trunk. And what so important about this artery? The splenic artery is usually tortuous. It's like coiled. You can see this artery here. It is coiled. And why do you think it's coiled? I mean, there are a lot of reasons. Let me give you some. During rotation of the gut, in embryology, the spleen is migrating to the left hypochondriac region. Okay, so due to that rotation, this artery is giving the room for spleen to elongate, like the distance can vary. Okay, that's reason number one. Reason number two, you know, the spleen usually moves with the respiration. As you are breathing in, breathing out, the spleen moves, because it's a little bit related to the diaphragm, okay, and the stomach. So this artery, the tortuosity of this artery gives the room of the splenic artery to expand and the recoil, expand, because something like a spring, so it's tortuous for that reason. But another important reason, mechanical reason, the spleen is acting as one among the reservoir of blood. So spleen is a reservoir of blood, it's a reservoir of blood, and due to its hematopoietic, and it has hematopoietic and the lymphoid function, it receives a lot of blood. And at times, due to variation of the systolic pressure and the diastolic pressure, this artery is tortuous to make sure the spleen does not, the small vessels of spleen do not rupture due to the variation of the systemic blood pressure. And that the rest of the reasons, go and find out. To have a lot of reasons for why the splenic artery is tortuous. And this is the splenic artery. So it lands on the superior border of the pancreas. And then on reaching the left kidney, it enters the splenocorenal ligament. And then it enters the spleen. What are the branches of the splenic artery? This is also very important. You see, this is a splenic artery, and the splenic artery, you see, it supplies the pancreas. So it gives the pancreatic branches, but not one branch, a lot of branches. So we have this one is called the greater pancreatic branch, which is a branch of the splenic artery. This is the dorsal or posterior pancreatic branch. It's also a branch of splenic artery, but it passes posterior to the what? Posterior to the pancreas. But this posterior pancreatic branch, or the dorsal pancreatic branch, it also terminates downside here by forming the inferior pancreatic branch. So we have the greater pancreatic branch, we have the posterior or dorsal pancreatic branch, and then we have inferior pancreatic branch. This is an anastomotic branch. You don't worry, we're going to discuss about it. It's an anastomotic branch. And the splenic artery, these are the pancreatic branches of splenic artery. But it also gives the short gastric artery that are going to the gastrium. What is gastric? The stomach. So it also gives the branch that is going to supply the stomach. Okay, but this is a splenic artery. It should go to the spleen, right? So it enters the hilum of the spleen here, and it supplies the spleen, and the spleen has got a lot of blood supply, blood supply here. Splenic artery. And then let me take you back here into this picture. And then this is splenic artery. After giving all the pancreatic branches and the short gastric branches, it also gives a branch that runs on the greater curvature of the stomach, and this branch is called the left gastroepiproic artery, or the left gastroomental. So it's a gastroomental artery, or the gastroepiproic artery. Is not seen from this picture because it is cut. The stomach is removed, so it supplies the left gastroepiproic artery, which is called the gastroomental artery. It supplies the greater curvature of the stomach. We're going to see later that this artery is anastomoses with the right gastroomental artery, or gastroepiproic artery, which is coming from GDA, gastroduodenal artery. We're going to see it later today. So this is just a brief on the branches of the splenic artery. Let's go to discuss the hepatic artery. Yes, this is the hepatic artery. Hepatic artery is one among the branches of the celiac trunk. It's one of the branches of the celiac trunk. So I didn't mention, but the splenic artery is passing behind the esophagus, behind the stomach. It runs on the superior border of the pancreas, but behind the stomach. This is obvious, guys. Let me take you back here. It goes. You see, it goes behind the stomach. So that is easy. Okay. So next we have this common hepatic artery, and the common hepatic artery is passing through the foramen in the lesser curvature, in the lesser sac, opening the lesser sac. Remember the foramen of Winslow? The foramen of Winslow, right? Okay, so this is a common hepatic artery. Now, what it is usually on the left side of the common of the bile duct, left side of the bile duct. So what are the branches of the common hepatic artery? Common hepatic artery, okay? The common hepatic artery is going to give this branch here. This branch is called the GDA, gastroduodenal artery, the famous GDA. You ever heard of GDA? This is your GDA, the gastroduodenal artery, the gastroduodenal artery. But it's also going to give this branch which is cut here. This is the right gastric artery. The right gastric artery is a branch of the hepatic artery, or the common hepatic artery. And the right gastric artery is going to anastomose with the lesser with the left gastric artery on the lesser curvature of the stomach. We have seen the left gastric artery supplying the lesser curvature of the stomach, and we said it anastomoses with the right gastric artery, and this is the right gastric artery which is coming from the common hepatic artery, or simply hepatic artery. Okay. And then we also have, so these are the main branches of the common hepatic artery. Now, the common hepatic artery, after giving the GDA, gastroduodenal artery, and the right gastric artery, it continues as hepatic artery proper. Not the way. This is hepatic artery proper. Hepatic artery proper. We had the common hepatic artery, or simple hepatic artery, but this hepatic artery wasn't the pure hepatic artery, because it carried some branches that are going to supply different parts. And so, yeah, it was a hepatic artery, but it's not the proper. Now, after leaving these branches, it goes to form the it's going to form the hepatic artery proper. This artery is going to the liver. So this is your hepatic artery. So let's see the branches. Let's see these branches. We've already seen that the right gastric artery is going to anastomose the left gastric artery on the lesser curvature of the stomach. But the GDA, this is the GDA. Remember, listen to the word GDA, gastroduodenal. This artery is supplying the gastrium, the stomach, and the duodenum. That means it should give the gastric branch and the duodenal branch. Let me start with the duodenal. So the duodenal branch of the gastroduodenal artery is called the superior pancreaticoduodenal artery. Superior pancreaticoduodenal artery is a branch of GDA which is going to supply the pancreas and duodenum. Okay, pancreas and the duodenum, but where? On the superior surface. So this is your superior pancreaticoduodenal artery, this one. Okay, and we're going to see that this superior pancreaticoduodenal artery has got the posterior branch and the anterior branch. Anterior pancreaticoduodenal and the posterior pancreaticoduodenal. But because this is GDA, after giving this pancreaticoduodenal artery, it's going to supply the gastrium. GDA, gastro, is going to the gastrium. So this is that last part of the gastric part of the superior of the gastroduodenal artery. This is the gastric part of the gastroduodenal artery. And the gastric part of the gastroduodenal artery, it is supplying the greater curvature of the stomach. Let me show you. I'm taking you back here. Let me take you back to this picture. Here. Okay? So guys, this is the gastric branch of the gastroduodenal artery. It supplies the greater curvature together with the left gastroepiploic artery. We say the left gastroepiploic artery is a branch of splenic artery, okay? And we said it anastomoses with right gastroepiploic artery, or the right gastromental artery. So the right gastromental artery is a branch of GDA, gastroduodenal artery. Okay? Summarize. Let me summarize for you. The common hepatic artery, as it gives the right gastric artery, and then it gives the GDA. Okay? GDA. Well, this is a suprarenal, the renal branch of this is variant. It's not present to every situation. This it is called the supraduodenal artery. This one, this supraduodenal artery. It is variant. It's not present to everyone. Okay. So let's summarize the hepatic artery. We have the common hepatic artery. The common hepatic artery will give the right gastric artery. It also gives the gastroduodenal artery, and then it becomes the hepatic artery proper. hepatic artery proper. But we'll say this gastroduodenal artery, which is called the GDA, it has two branches. It has the superior pancreaticoduodenal artery, and also it terminates by forming the right gastroomental or right gastroepiproic artery. What structures is supplied by the superior pancreaticoduodenal artery is going to be this artery is going to supply the pancreas and the duodenum, because we've said the second part of the up to the second part of the duodenum be supplied by the celiac trunk. Last, let's talk about the hepatic artery proper. Now, after giving these branches, it becomes hepatic artery proper, and the hepatic artery proper will divide into right hepatic artery and the left hepatic artery. So this is a left hepatic artery, and this is right hepatic artery. Left hepatic artery and right hepatic artery. But the right hepatic artery, this is right hepatic artery, is going to give a cystic branch. So it gives a cystic artery. A cystic artery is going to the gallbladder. So the gallbladder is supplied by the cystic artery, which is the branch of right hepatic artery. The right hepatic artery is the branch of hepatic artery proper. The left hepatic artery is the branch of hepatic artery proper. The hepatic artery proper is the branch of common hepatic artery. What are the other branches of common hepatic artery? We have the right gastric artery. We have the superior pancreatic. We have the GDA, gastroduodenal artery, and then we have this. We have this supraduodenal artery, the supraduodenal artery, which is a variant. Okay, that sounds like pretty much it. We haven't discussed about the conditions of the celiac trunk. Make sure you go and find them. And this is what I had for you. And see you really soon.